Hi, my name's Phil and I'm one of the GPs here at Green Square Health. Now today I wanted to talk about middle ear infections, or what we call otitis media, because we've been seeing them around the practice a lot. Now they're most common in children, but they can happen in adults as well. Typically what you'll see is a grizzly child with a fever, sometimes tugging or pulling at the ears, sometimes miserable, sometimes even with some hearing impairment, maybe not responding quite as quickly as they usually do. Now, the difference between infections in the middle ear versus infections in the outer ear or the ear canal that we can see, so the middle ear is a sealed dome and it's separate from outside, so even the best ear drop can't get into the middle ear to help with a middle ear infection. Usually what we rely on is painkillers like Panadol and Nurofen to treat middle ear infections, except for special groups of children, like those who are very young, Aboriginal and Torres Strait Islander children, and children who have had previous surgeries to the ear. What we often discuss with parents is that in the long run, if a child's treated with antibiotics every time they get an illness, they have about a 7% chance each time of picking up a complication from those antibiotics. And not only that, antibiotics can make it a bit more likely that kids are susceptible to resistant bacteria, and they can give more mundane side effects like rashes, diarrhea, and allergic reactions. So we try not to use them for every infection. So when it comes to middle ear infections, what we know is that there's only a few certain conditions that mean that we should usually give antibiotics. Those are children who are under 6 months, children who have both middle ears infected who are under 2 years, children with immunocompromise, children who are Aboriginal and Torres Strait Islander, and also children who are systemically unwell. Now this is something that's a bit difficult to define, usually best defined by a doctor here at the practice with a physical in-person appointment. Can be scary to have a child with a fever, but usually it means a fever and something else. So for instance, a fever and struggling to get any fluids in for say a whole afternoon or something like this. So if your child has an ear infection and you have any concerns, please bring them in and we can have a look. If they get through their ear infection, that's great. If you're concerned after the fact that their hearing hasn't come good quite as quickly as you'd hoped, or they're having recurrent ear infections, then that's another good reason to bring them in and we can have a look. So nice to meet you. Hope you found that helpful and look forward to seeing you around the practice.